Hi, this is Billy Pelche, and I'm presenting the signs and symptoms of necrotizing fasciitis, the treatment and procedures, and the prognosis of necrotizing fasciitis. And what we're going to start with is the signs and symptoms, and that can be divided into early symptoms and also advanced symptoms. The early symptoms, the person may feel like they have just pulled a muscle or they're under the weather, they're experiencing flu-like symptoms. These could be anywhere from just fatigue, feeling weak, maybe a slight fever, some chills, a sore throat, nausea, vomiting, dizziness, um, and some stomach aches, and then maybe some urination, infrequent urination. And this basically is occurring because of the bacteria that's festering this infection. And this bacteria, there's usually two types, the Streptococcus aureus and the Clostridium. And part of the early symptom is the person may notice a lesion or just a red papule any part of their body. It could be at a surgical site, it could be where there may have been a cut or a scratch, a bruise, or even where someone might have just received an injection, so an injection site. And so as these symptoms progress, so does the pain that is surrounding that pustule or lesion. And so um, as those symptoms progress, as the infection progresses, the red bump actually turns into quite a lesion or a bulle, and the person suffers from very much pain, very huge pain, excruciating pain, and it's very piercing. They could also have a high fever, a temperature greater than 104 degrees, become very dehydrated, or have even episodes of hypothermia. And the lesion now is very bright, shiny, swollen, and hot to touch. And as the infection progresses and continues, the area swells. And then it turns a different color. It could be black or purple, or black, purple, and red. And then the more blisters and more lesions form. When they turn black, purple, and red, that is a sign of skin necrosis. What can also happen is that these lesions can burst open as well, and there is a reddish brown discharge emitted. Um, as the infection continues, remember earlier in the early signs, that area around the lesion or blister is very painful. But as this infection progresses, the pain actually seems to improve. And that is a sign of nerve damage or death. And from that, we come into some very, very critical um, problems. The person can become very hypertensive, tachycardic, there's a lot of weakness, and then we could end up in with some confusion as well. And so as you can see, the signs and symptoms in the beginning are very vague, but as it progresses and the infection continues, then we have more issues and more problems, and that's when we need to start to proceed with treatments and procedures.